Hi everybody. Today I'm here to share on a few tests such as nail clubbing test or otherwise we call it as the finger clubbing test or otherwise we can also call in other terms such as Shamroth test. So let us see in detail of how the Shamroth test is being done. So in this session, we'll be going of how the nail clubbing test can be done. What is the definition for Shamrock finger test? What are the possible causes of nail clubbing? What are the common signs and symptoms of clubbing of fingers? And you'll be able to enlist what are the stages of clubbing as well as the test how it is to be performed. So in this, you can see the picture that this is the window. That is a diamond shaped window between the pink nail polish and the fingers, index fingers. So what we do here is that the patient is being asked to oppose both the fingers, both the index fingers on back to back against each other, and you have to check in for the window, diamond window shaped space. Normally it should be present so that there is no changes in the nail beds or in the nail angles between the two fingers. So this is the nail clubbing test, or otherwise we call it as the Shamroth window test. So this on the first picture you can see that the normal window, you can see a diamond shaped window. Whereas in case of a clubbed fingers, the Shamrock window is totally lost. So you call it as the window is absent, which causes due to clubbing of fingers, which will be an indicator that the patient is suffering from either respiratory, cardiac or any GI disturbances. So what can be the possible causes of finger clubbing? So there is a mnemonic called as clubbing. C for cyanotic heart diseases such as either ASEP or that is acyanotic, the heart diseases such as patient is having from left to right shunt, that is mixing of oxygenated blood, the deoxygenated blood into the oxygenated blood, that is all the mixing of blood will be taking place. And in case of any cystic fibrosis, and if the patient is having lung cancers or known case of lung abscesses, case of ulcerative colitis, bronchiectasis or benign miscellaneous infective endocarditis, idiopathic pulmonary fibrosis, neurogenic tumors and gastrointestinal diseases can have finger clubbing. The common symptoms the patient may complain is that the nail buds are always soft and the nail may seem to float instead of being firmly attached. And you can also see a sharper angle with the cuticle, and the last part of the finger may appear large or bulging, and the nail curves will be always downward so that it is looking like round part of an upside down like spoon like pattern. Hence we call it as spoon shaped nails as well. So this picture is denoting all the common symptoms of a clubbing of finger. So how we can grade this clubbing? So normally there is no visible clubbing, that is the nail buds are very soft and no visible changes of the nails. And in the remaining four pictures you can see that the nail fold is filled, grade 1, and second one you can see it is like a beak like pattern which we call it as grade 2, and here there is increase, or we call it as there is increased convexity of the nail fold and clubbing is very apparent. And in grade 3 you can see the pulp of the anterior posterior region. When you do the pulp is very heavy, that is thickened, which shows the grade 3. And in grade 4 it is increased lateral, that is from not antero-posterior, from the sides there is increased thickness, which shows there is gross clubbing, or we call it as it is resembling like a drumstick pattern. These clubbing can be taken place in the exact causes such as respiratory or cardiac diseases when there is cyanosis due to decreased oxygenation to the tissues, as well as hypertrophic osteoarthropathy is also can be a major cause for developing this clubbing. So we have to be very clear whether the clubbing is purely due to the cardiac diseases or respiratory diseases, or might be it is a nail fold abnormality or bone abnormalities. To summarize, the test is that, so this test is performed to rule out respiratory, cardiac and GI disorders. So either we go in for the lateral diameter or the anteroposterior diameter. Either you can also go in for the size of the phalanges, and you can go in for the Samroth sign test. To conclude, we can call this term as acropatchy. One theory says that clubbing is response due to arterial hypoxemia, which is due to the release of an unknown humoral substance which causes the dilation of the vessels of the fingers and the toes. Another factor or another theory what they say here is that clubbing results from neurovascular abnormality as well. So these are the possible assessments where you can go through, and these are the references which I have taken for nail finger test or the clubbing test, and pretty very much happy to share this video on how do you perform the Shamroth window test or nail finger clubbing test. Thank you so much for your patient listening. Thank you.